guys, welcome back. So on this video we are going to learn on another method of contraceptives. So we have already discussed about contraceptives, combined oral contraceptives. We have discussed about progestin-only pills, that are the POPs. We have discussed about emergency contraceptives pills also. So on this topic we are going to discuss about injectables. What are injectables? So we have Depo-Provera, which is the most widely used injectable contraceptives, or DMPA, depot medroxyprogesterone acetate, which is Depo-Provera. So it's an injection that is given every 3 months. The injectables, these are progestin-only injectables. Though the return of infertility is often delayed, it takes several months longer on average to become pregnant after stopping progestin-only injectables than often other methods. They do not contain estrogen and so can be used throughout breastfeeding and by women who cannot use methods with estrogen. So how does it work? It actually suppresses hormones responsible for ovulation. Also it thickens cervical mucus to block the sperms as they travel. So how effective? Effectivity depends on getting injections regularly. Risk of pregnancy is greatest when a woman misses an injection, as commonly used about 3 pregnancies per 100 women using progestin-only injectables over the first year. When women have injection on time, less than 1 pregnancy per 100 women, that's how effective they are. So what are the side effects? Changes in bleeding patterns. So we have first 3 months we have irregular bleeding, prolonged bleeding at 1 year, no monthly bleeding, infrequent bleeding, irregular bleeding. Fewer days of bleeding in the first 6 months are less likely to have no monthly bleeding after 1 year than DMPA users. So there is weight gain. Actually, there is headaches, dizziness, abdominal bloating and discomfort. There's mood changes, less sex drive. So who can use injectables? So the people that can use injectables are women of any parity, including nulliparous with established menses. So these are any women that depending on how many pregnancies that you have had. Even if you're starting getting pregnancy, they can be used by any women. So the breastfeeding mothers after 6 weeks postpartum. So after 6 weeks of giving birth, that's when you can start using the injectables. We have post-abortion clients, also if you have undergone through abortion, so this also can be used by them. Women with uncomplicated diabetes or hypertension, valvular heart disease. So the women that have uncomplicated of these diseases, the diabetes patients, hypertension and valvular heart diseases. So we also have women with STIs. These are sexually transmitted infections and pelvic inflammatory diseases. We also have women with the HIV and AIDS and doing well on ARVs. So those are also people that can use injectable. But also we have those people that should not be using. So breastfeeding women less than 6 weeks should not be using if you're breastfeeding less than 6 weeks, you should not be using injectables. So women with liver disease, women with breast cancer. There's also women with severe hypertension. There's also women with unexplained abdominal vaginal bleeding should not be using injectables. So women suffering from deep venous thrombosis also should not be using these injectables. So how effective are these injectables? Actually, they are highly effective, and they are safe, and they're easy to use. So it's the another benefit. It's a very long time, usually 3 months. Take reversible. It can be reversed also. Can be discontinued without provider's help. So you can just discontinue if you prefer a pregnancy. Also, you just don't get an injection. Can be provided outside of clinics. Yes, use can be private. Yeah, you can take privately without anyone knowing. So has no effect on breastfeeding. That's another. So what are those myths again that we must correct about injectables? So one of them is they can stop monthly bleeding, but this is not harmful. It is similar to not having monthly bleeding during pregnancy. Blood is not building up inside the women. So one of these is that they stop monthly bleeding, but the monthly bleeding is not harmful to women. It's like when you're pregnant, but actually you are not pregnant, but you're not having monthly bleeding. So they do not disrupt any existing pregnancy. They do not make women infertile. That's one of the misconceptions that we must correct. Thank you guys for watching this video until the end, and thank you. Please subscribe to my channel, and if you haven't watched the other videos on combined oral contraceptives and progestin-only pills, you can just you can just look at the past videos, and you're going to learn on the methods of family planning. So please subscribe and hit that notification bell and get notified whenever I post any video. Please subscribe, and see you next time.